Dr. Deidra. I conducted a study titled Pre-Dialysis Factors and the Timing of Dialysis Initiation Among Older Adults. We were interested in looking at this because the optimal time to start a patient on dialysis is not known, and there has in particular been a trend towards older adults starting dialysis at higher and higher GFRs. And so we were interested in seeing if the pre-dialysis course for these adults may influence a nephrologist's decision in deciding to go ahead and start them on dialysis. So we conducted the study using data from the U.S. Renal data systems, which does include all patients who are treated with dialysis in the United States. And what we looked at was the frequency with which the patients were being seen by a nephrologist prior to starting dialysis. We also looked at how frequently they were being admitted for congestive heart failure in the 6 months preceding dialysis, and we also looked at their burden of comorbid diseases in the time period prior to starting dialysis. And we did all this using Medicare claims data. And in the end, what we found was that those patients who started at a GFR of greater than 10 were those who were more likely to have had multiple congestive heart failure admissions and who had greater burden in comorbid disease. But interestingly, there was a trend towards those patients who were being seen more frequently by nephrologists actually starting dialysis at lower GFRs, or GFRs that were less than 10. So in the end, it appears that these pre-dialysis factors definitely likely influence a nephrologist's decision, and further studies should take these pre-dialysis factors into account when looking at outcomes for older adults who are treated with dialysis. These outcomes that would be important to look at would be hospitalization, certainly mortality, quality of life, etc.